My name is Kathy Mortillaro, and my body system that I will be assessing is the head, neck, and lymph nodes. This is Mr. Smith, and he is going to be my patient for this assessment. Mr. Smith, my name is Kathy, and I'll be performing this assessment. Are you comfortable on the chair you're sitting on?
Yes.
Okay, we can get started. I'm going to inspect and palpate your scalp. If you can look down for me. Okay, and I'm just checking for symmetry and any lumps or anything that would look out of place. Okay. Next, I'm going to do your facial expressions. Can you smile for me? Good. And checking symmetry of your facial expressions will reflect the function of your cranial 7 nerve. I'm going to get your temperature because you did come in with some fever. And the rest of your symptoms were nasal congestion, malaise, pain in your head. So we'll check all that for you. Okay. All right. The next thing we're going to do, I'm going to palpate your temporal mandibular joint. So I need to ask you, Mr. Smith, to open your mouth for me and close. Open and close. Okay, now this joint should move smoothly. They should have no tenderness. You should have no pain and no crepitus, which is locking and popping in your jaw. And I do not feel any of that. So the next thing we're going to do, Mr. Smith, I'm going to feel some areas on your face. And I want you to tell me if you're having any pain in those areas. Okay, this is your maxillary sinuses. Do you feel any pain there?
Yes.
Okay, and this is your frontal sinuses. How about there when I press?
Yes.
Okay. That has me thinking that you might have some sinus issues going on. Okay, now I'm going to check your head and neck for your lymph nodes to see if you have any lumps or pulsations or anything there. If you lean your head forward for me and just relax your muscles, and this will just make it easier for me to feel your lymph nodes. So the first ones we're going to do are your head, and the first one is the occipital lymph node, which is at the base of your skull. I'm going to use my 3 fingers in a circular motion to feel those. Okay. The next ones we're going to do are the post-auricular, which are behind the ear over your mastoid process. I'm going to use the same motion. Okay. Next is going to be the parotid, which is at the angle of your mandible. Do you feel anything, any pain there?
No.
Okay. All right. So the next ones we're going to do are the lymph nodes in your neck. The first ones are the anterior cervical lymph nodes. Those are down the front of your neck. Okay. Then the posterior cervical nodes, almost to the middle of your neck, not quite. And then we have the deep posterior cervical nodes, which are deeper down, so I'm going to push a little bit harder. Okay. The next ones are along your clavicle, which will be your supraclavicle lymph nodes. And I don't feel anything there. I do feel on the right side a swollen cervical lymph node, which is also an indication of your lymph fluid draining into your from your sinuses into your lymph node. So that's why you're feeling that tenderness. Okay, I'm going to check the motion of your neck. So I need you to tip your head forward. Good, and tip your head backwards. Good. Now I want you to turn your head to the right and to the left. All right, Mr. Smith, if you could shrug your shoulders for me and down. And we're going to do the same thing, but we're going to do it against resistance. Okay? Tip your head back. Good. Tip your head forward. Good. Tip your head to the right. Turn your head to the right. All right. And to the left. Good. And I want you to shrug your shoulders. Good. Okay. And this, what we're checking for, is your function in your cranial nerve 11. So everything looks good there. Now I'm going to check your carotid pulses for any kind of pulsations in those. And we're going to do 1 carotid pulse at a time. Well, let me just check on it first. Okay, now I'm going to listen. We're going to auscultate to see if we hear any bruise. Okay, sounds good. Now, Mr. Smith, we're going to check your trachea. And by doing that, I want to see if it's midline, so I'm going to put my fingers here and just go down and make sure everything is in the center. Okay, it seems to be all midline. All right, now we're going to do your thyroid gland. And in order to do this, I need you to take some sips of water for me. So I want you to drink and just hold it until I tell you what to do with it. Okay. You want to hold it? I'll take it. Okay. I'm going to feel on this side as you swallow. Good. And one more time for me. Okay, swallow. Good. Now, I'm going to ask you to take one more sip and hold it. And I want you to tip your head backwards and swallow. Okay, good. Okay, I don't feel any lumps or anything there. There's no borders that I can feel. I don't see anything enlarged. The only time you will visibly see an enlarged thyroid gland is from the side, but I don't feel anything either, so I think your thyroid's good. So, I think what looks like is going on here is an infection of sinusitis. We can give you some Motrin, 600 milligrams. We can give you some Robitussin, 2 teaspoons. I'll reassess you in about an hour, and then I will be notifying the physician with all the results of the assessment. Thank you.